Welcome to the Conscious Fertility Podcast. Today I have Dr. Elizabeth Stener-Victorin, and I'm talking to her now because she runs a very busy schedule. She's driving somewhere in Sweden, and I'm so happy that you made time for us to have this discussion. We're going to talk about PCOS. I do want to introduce our audience to Elizabeth because we've met on many occasions. She's spoken at the Integrated Fertility Symposium, and we've met in, I think, somewhere in Rothenburg or somewhere our paths have crossed before in person. And now I get to interview her and catch up with her on the Conscious Fertility Podcast. So Dr. Elizabeth Stener-Victorin, she studied physiotherapy at Lund University, graduating way back in 1985. She completed her doctorate at the University of Gothenburg in 2000, and she was a postdoctoral researcher at the International University of Health and Welfare in Ottawa, Japan, and that was 2002 and 3. And then she became an associate professor in 2004. She established her research group, Reproductive Endocrinology and Metabolism, at the Department of Physiology and Pharmacology in January 2015. Elizabeth was previously with the Department of Physiology at University of Gothenburg, where she held a VR granted junior research position, and since 2009, a senior research position. Her group's research activities aim to yield new key information on the pathophysiology of polycystic ovarian syndrome, which is the most common female endocrine and metabolic disorder. Its etiology is not well understood, but genetic, epigenetic, and environmental factors have been implicated in its development. They also investigate the effect and mechanism of acupuncture and or exercise on reproductive function, on high androgens and insulin resistance, as well as on key molecular pathways and epigenetic modifications in adipose and skeletal muscle tissues. Elizabeth, welcome to the Conscious Fertility Podcast.
Thank you, Lorne, for this very long introduction.
Well, you've done a lot in this field, so I think that's brief for so much what you've done. And what I would like to do today is, because you are a researcher and also have been involved clinically, to kind of bring this to the public and share kind of what you've been doing and why this is relevant to our listeners. So I thought we would kind of just start off like, why would we care about this condition PCOS? Like, what are its implications on the person trying to conceive throughout pregnancy? Is there any impact on the child, on the mom-to-be? So why do we care about this, and why are you so interested in studying this condition called polycystic ovarian syndrome?
PCOS, is the abbreviation for polycystic ovary syndrome, is so common, affects around over 11 to 13%, we say, is the prevalence, but the prevalence increase with overweight and obesity, and in severe obesity is as many as 1 in 4 that actually are affected. And it affects in many different ways. As you already mentioned, the reproductive part is maybe the first thing many think of, because you get the diagnosis if you fulfill 2 out of 3 criteria. You have high circulating androgen levels, or you have disturbing hair growth, or acne, or baldness, male pattern baldness. And that is also a sign of high androgen levels. So that is one sign. And you have irregular cycles, which means that you have infrequent ovulations, which makes it more difficult to become pregnant. And you have many small follicles with oocytes or eggs, which means that you do have a lot of eggs. It's not the problem, but they do not mature properly. And this is because of the hormonal imbalance. So if you have 2 out of 3 criteria, you have a diagnosis. And despite that it is so common, we do not really know the underlying pathophysiology and etiology. And that is really what's driving my research, and try to understand the etiology, but also the pathophysiology.
Okay, and you had mentioned like one of the things about adipose tissue or being overweight. In my clinical practice, I would say I see more thin PCOS than overweight PCOS. So do you have to be overweight for this to have this condition?
No. And sometimes I say that actually it's maybe the most interesting or best to study is the normal weight or the lean PCOS women, because as soon as you are overweight, obese, you add on an additional component that is a confounding factor. But maybe you say that you see more mainly normal weight. This is very uncommon, I would say. It
Yeah.
depends on where you live.
Yeah, so I'm in Vancouver. Maybe it's the active outdoor lifestyle. Like you know, you're always outdoor doing your wave kite surfing or whatever.
Yeah,
So
I
maybe,
think if you see in US and you see in California, yeah, there you have many normal weight women with PCOS.
yeah.
But the rest of the, and maybe the big cities, but in the rest of the US, I would say the majority are overweight or obese.
And so you can have this condition and have, like, as you call it, lean PCOS. Are you still seeing the insulin resistance and those issues in these patients then?
I think it is a very important thing to bring up, because also the normal weight women with PCOS develop insulin resistance and hyperinsulinemia, so they have high circulating levels of insulin. And 40 to 50% of these women develop type 2 diabetes at an early age. And it's also the normal weight women.
You know,
And
this,
here we believe that it is very much an androgens are the driving factor.
so the high androgens are the driving factor. So I kind of
Yes.
want to get into the mechanism, but first, just the thought I have, and I'm curious what your thoughts are, is often the women will jump into an ovulation drug protocol when they're trying to get pregnant, so like Clomid, letrozole, or IVF. But I don't think that solves the problem, because there are so many. I think you talk a lot in your research. You know, there's the mental health or psychiatric disorders that come with it. There's reproductive disorders, and there's metabolic disorders. And when I was reading through your research recently, having this condition in pregnancy has an impact on the child, and I think you talk about even transgenerational impacts. So can you talk a bit about that idea, or share about what are the risk factors when you have this metabolic disorder? And again, where I'm thinking, I want to lean into you for this, is I think the ovulation drugs or the IVF should come later after you've done some intervention to try and balance these hormones. But it seems very often that's the first act that these women do. And then if that doesn't work, they come and see somebody else to try and help balance their hormones. So I'm just thought you could share a little bit about the mental health, reproductive, metabolic disorders. And then in some of the papers you shared, what happens in pregnancy that you have seen in your research when you have this imbalance for the mom and the child? And I think it's more than one generation your research shared.
Yeah, regarding just to this transgeneration, it means that it has to be seen in the third generation. And this is on experimental level. It's very difficult to study transgenerational mechanism in humans. So this is based on animal research. We look at the next generation in the humans, just to make that clear. It is very important, as you bring up, the mental health issues and also quality of life. And today we don't really know whether that is a consequence of having all the symptoms linked to PCOS. You have your irregular cycles, you have difficulties in becoming pregnant, you often get miscarriage also, and you have your obesity problems. What is the driving factor of their mental health issues? Is it just a consequence of these, or is it something that is part of the etiology? We still don't know. From our animal research, there we have both a normal weight or lean model of PCOS, and we have a overweight or and obese models. We can see that both in the normal weight and in the obese model, the mice develop anxiety-like symptoms in the first generation, and that can be transmitted transgenerational into the third generation, especially in the females, but also in the males. The males seems to be more affected if the mother is obese, whereas the females are more affected by high androgens.
So this is what I wanted to just highlight, is that you just said the male, because I often think of PCOS going through the female line. So if you have a daughter, there's issues, but you're saying that if the mother has PCOS, and now I'm hearing, and she's overweight, the son can also have issues? What would these issues be?
The issues is that they normally become obese. They get like metabolic syndrome. They have the lipid dysfunction, but they can also, in the mice, we can see that they have also reproductive issues. We looked at the sperm morphology and also have done molecular analysis of the sperm and the testis morphology. We see that it is altered both in those that are exposed for androgens, obesity, or the combination.
This is why I like the idea of an intervention through diet, exercise, acupuncture, supplements, medications to help with this metabolic disorder, the high androgens, so we can interrupt this epigenetic impact or transgenerational. Can we talk a little bit again about the issues? So you talked about some of the mental health issues, and maybe it's related to the symptoms. I've been reading your papers and others that there seems to be an inflammatory component when it comes to PCOS. I even believe maybe some microbiome issues too in the gut. And we now know that a gut microbiome and inflammation, it can affect our mental health, our mood. Have you guys thought about that whole, because it's really a systems that's why it's a syndrome, right? It's not like this one little thing. It's a
no. No, it is really a syndrome, and that can be like what we say, many different phenotypes and appearance. And we have studied the gut microbiome. I had a student, very talented, who had investigated the gut microbiome in women with and without PCOS, and found that they have an increasing beta diversity of the gut microbiome. And she contacted me because she wanted to do more mechanistic studies. And at the moment, we then had our ongoing trial that we exposed the mother for either high-fat diet, with or without androgens during pregnancy. And then we studied the offspring. So we collected their stools, and we collected also their intestine, and performed this gut microbiota analysis, molecular analysis. And indeed, they do develop a very similar gut microbiota phenotype as women with PCOS. But we also try to see whether this has a causative effect, so it actually can be causing PCOS. So we tried to do, we did a transfer of a stool into healthy mice, and we could transfer the gut microbiota phenotype, but not the anxiety-like behavior, reproductive dysfunction, or obesity. So our conclusion from those studies were that indeed they have an altered gut microbiome, but that it's not a causing. It might be a secondary effect. So yeah, that is a gut microbiome. And then we talk about inflammation or the immune system. And that is something I have been trying to keep away from because it's so complicated and difficult. But I had two very talented PhD students, and one is still in the lab, and they really wanted to go. They are immunologists also. So they really wanted to understand how our mice that are exposed for androgens have like a PCOS-like phenotype, how their immune system is affected. And we have published 2 papers there and really demonstrated that they have an altered immune function in different tissues. And we believe that it's very important to look into the different tissues to understand the immune function. And here is adipose tissue and endometrium, the 2 tissues that are most affected, which is super interesting. And they're not affected in the same way, but it might explain in part their alterations.
And because of the inflammation, and then you're just sharing the immune cells, I'll just say again why I think preconception care, doing things like diet, lifestyle, supplements, acupuncture, may be something to do to change this profile, this phenotype before you are pregnant. But what are the implications then to the immune cells that you're seeing that you find very interesting? Like, and I'll just add to it, just for our audience, like what I'm thinking about is if somebody has this syndrome, is it impacting their embryo quality? Is it impacting uterine receptivity and why? Does it impact the placenta? Does it matter during their pregnancy? So let's say they get pregnant on Clomid. Is there risk factors during their pregnancy? And is there risk factors to the child to be born? Yeah, so that's kind of my question for you, is that holistic view of it. Again, why do we care? Because I understand the patients we see, they want to get pregnant. They want to get pregnant as fast as possible. My goal is healthy baby always, and healthy parent. And so I just want to be that voice, and I want to hear the research behind that. So I'd love to hear more about this syndrome and how can it affect embryo quality? Can it affect uterine receptivity? You mentioned they have a higher risk of miscarriages. Is it impacting the placenta? And if you get pregnant and you have PCOS through IVF or an ovulation drug, can this syndrome still be impacting you throughout the pregnancy? So just getting pregnant is not the solution, or it is the solution? And I'd love you to tie in the immune cells, inflammation, and some resistance. Just let us know kind of from a holistic perspective for our audience why they maybe want to care or do some preconception care.
That was a lot in one question. No, I'm kidding. I'm joking.
You know me.
No, but first of all, I completely agree that the preconception care, or what you do before preconception, I think that is very vital and very important. And whatever you can do before, I think is very good. And then I'm thinking of more lifestyle management, a good diet. Talking about diet, I want to emphasize that there is no diet that have been shown to be better than another diet in PCOS yet. There is still the old plate model that is the only one that have been shown to be a good one.
What's that?
With that said, there is very little and good research in this area. And I would say that finding your diet is the most important. I don't think it matters so much which diet you are on, just that you keep your diet, and especially that you do not gain weight. I think that is the key. This that you go up and then you is on a very strict diet and you lose weight, you cannot keep this diet and you gain weight. That is not good. You go up and down. So that is for the diet. There might be something that we still don't know, but I want to go for the evidence. What we do know is that exercise, whatever exercise, there is no exercise that have been shown to be better than another exercise, but do exercise is the most important. So both what you eat, or how that you have regular meals and so on, and of course avoiding too much sugar and so on. I think that is important. You do your exercise, and it's important that you find the type of exercise that you can maintain and do regularly, not that you do it in periods and then very intensive. And then of course you can add on, if you would like to try acupuncture to try to induce more regular cycles, that is also something that could benefit. And we know that acupuncture can, for many women, also makes them feel more relaxed and can have positive effects on anxiety.
Question around the acupuncture, because that's kind of how we met in the early days from your acupuncture and PCOS research. So I think one of the mechanisms I recall from your talk that you gave at our conference was on, it did help do something with the blood sugar or insulin metabolism. Are you still suggesting the electrical acupuncture, adding the stim to it? Is that basically what your research has still been, or what has there been any change? Because I remember we talked about dosage, as in some people they'll need more than 2 or 3 a week because it's outside the research, just if it's stubborn PCOS. And I remember you used to do electrical stim as well in your research.
Yeah. First of all, we have done several studies with acupuncture to induce more regular cycles. Now I go out from the car.
Right. Elizabeth has been so kind to find time, and so she's about, and she was being driven. By the way, she was not the one driving that car; she was being driven. So yeah, I'd love to hear a little bit more about the acupuncture and what your thoughts are as a way to help regulate.
Yeah, from the basic or the beginning, I started off my research doing acupuncture research within IVF, and we saw that we could increase the uterine artery blood flow by acupuncture. And And then at the same time, we also started to do studies that we investigated whether acupuncture could be a tool to use as a pain relief during egg collection. And all in all, what we did show in all these studies, we did see that it increases uterine artery blood flow, which is something positive if you do IVF, but we have not shown that it can increase the pregnancy outcome. I think this is something that is very important to inform your patient that we prepare, but we do not treat infertility. And then at the same time, and we saw that it could be used as a pain relieving.
Can you clarify that? When you say we prepare, but we don't treat infertility, can you elaborate or clarify what you mean by that?
You prepare the uterus, you get a better blood flow. You might also actually affect the endometrium, but we don't know that yet because there is still no research about that. So I think it is more that you prepare the uterus. You can say that you also prepare the person, that you reduce the stress. We have shown in our studies in PCOS that we can, if you have very regular cycles, we can trigger the ovulation.
So the acupuncture can help regulate the ovulation?
Yes. Now to your other question, whether we still use the electroacupuncture, is it needed or not? I would say I don't know, honestly, if we need it. For me, we use it very much still in our clinical trials because it's easier to standardize. You know that where you place the needles, and then you know how you stimulate the needles. So it's very much also to get like a standardization, but I cannot tell whether it's better or not compared to manual stimulation.
I wanted to pick your brain on a few things that we've talked about. So in your papers, you talk about this high androgen environment and how this can impact the placenta's health and uterine receptivity, right?
Mm-hmm.
And then obviously the health of the mom and the baby. It sounds like because of this high androgenic male hormone level, you're having these follicles not able to mature. So if you're doing the acupuncture and it helps regulate ovulation, I'm deducting then that we're somehow, maybe we're helping lower the androgenic level, but we're balancing the hormones. And if somebody's coming in ovulating every 50 or 60 days, and now they're ovulating every 35 days, I would deduce that you've changed the hormonal environment, evidenced by their maturing eggs in a more periodic time frame, like a healthy time frame. And that means that would not have the negative effect, so it would be positive on uterine receptivity, on the placenta health.
Yeah, I would say that regarding that they get more regular cycles, and we have also seen that it also lower their androgen levels. Both exercise and electroacupuncture lower their androgen levels. And exactly as you say, we get not a normalized hormonal milieu, but it is better, it's improved. So that all this is positive.
And so with acupuncture, it's another thing hard to do, that random RCT, randomized control trial. It's very difficult for to blind the practitioner, right? The practitioner kind of knows they're using a needle or not. It's difficult to blind the patient. And so I'm curious, maybe that's why we don't have so much research, because we're always trying to do it as an RCT. And some modalities, therapeutic modalities, don't fit well into an RCT.
No, I would say that any physical intervention, like it can be exercise, it's the same. You cannot placebo control exercise. You cannot placebo control acupuncture in my mind. I think all this, when you place a needle superficial or, use placebo needles, it's just another kind of sensory stimulation. No, it is very difficult to get a high score in a review because there is also a lot of bias, and you never have a completely blinded intervention. So it is a problem for all kind of physical intervention. And then for some reason, I would say acupuncture, maybe it is because it's an ancient, and also that you involve the yin and yang and theory of a traditional Chinese medicine, it makes it very difficult for the general orthodox medicine to understand.
Yeah.
I think that is one thing. Maybe they have easier to understand and bring in the laser because it's more.
Well, you can definitely blind it because they did do one study way back in an IVF setting because the patient doesn't feel the laser and it just beeps. And so they had a mechanism where the laser would beep, but it wouldn't give off any photons. So neither the patient nor the practitioner knew who was getting it. So there was one group, and in that group, they showed an increase in implantation in the IVF setting. So they did it on transfer day before and after. They did the typical Paulus protocol back then when they did the study in 2008-ish, and they did the before and after, and they had a acupuncture group, they had a laser group, laser acupuncture, and they had a sham laser acupuncture and a control group. And the laser acupuncture group outperformed the acupuncture control and sham group. What I liked about this is it wasn't just placebo or anything because the sham didn't do anything, right? The sham laser. So talking to my colleagues, they're showing that there was at least some type of impact when you put photons into that acupuncture point in that study anyhow. And I always say, I don't know how you feel about this, but it kind of drives me a little crazy when I see a research study and it says acupuncture works or acupuncture doesn't. We kind of got to say this acupuncture protocol worked or didn't. It'd be like saying you give somebody a prescription drug and then you say all prescription drugs work or all antibiotics work or no antibiotics work. Like, acupuncture is like a category like antibiotics, but we got to know what antibiotic and what dosage. And we often say, like acupuncture, dosage matters, right? So what would you be recommending if you're in clinical practice? Because we know that this metabolic disorder, this syndrome of PCOS, because of the high androgens and other implications because of that, inflammation, insulin resistance, there's an impact on the oocyte, impact on embryo quality. It impacts, from your research, so tell me if I'm interpreting this wrong, impact on uterine receptivity, impact on placenta. So it impacts you even during your pregnancy. If you do Clomid or IVF and you get pregnant, you still have this condition. And then it's transgenerational, that it can impact your future children. So what are the things that there is data to say that this can help you, that we'd want to recommend to these women to make sure they're doing this to help them before they go in? And I still think that preconception would be key then, to see if you can get your ovulation more regular.
I do agree that I believe that the preconception is detrimental and very important. You ask for the evidence. Unfortunately, there is no evidence yet because there is no, it's very difficult to study. Also, if I would give an advice to a woman with PCOS, I would definitely say, and you feel that it's not an extreme stress given the age, I would say, okay, give it 4 to 6 months, live a healthy lifestyle, try to do regular exercise, keep a good diet, try acupuncture if you have irregular cycles or insulin resistant, to try to regulate your hormonal imbalance and improve your insulin sensitivity. And hopefully you become pregnant naturally. If not, you start with your letrozole. Letrozole is the first line treatment today. And the next step, that is IVF. And I would say, unfortunately, many skip both the first and go directly to IVF. And I think that is completely wrong for women with PCOS.
I see after they've done the IVF and it's not successful, they'll come off and when I do the history taking, they did IVF, they developed ovarian hyperstimulation syndrome, which is dangerous and uncomfortable. And then the transfers haven't worked or they've had miscarriages. And as I shared, even though we don't have research on this, I'll give you my anecdotal. We have seen I always share when I talk about PCOS because she's my favorite case where she would not ovulate on her own. Even with the letrozole and Clomid they tried, they couldn't get her to ovulate while she'd have a withdrawal bleed with the progesterone. So she went through IVF and the first transfer was negative. The second one was chemical. So she came because she heard maybe it will help with uterine receptivity. Can you help with blood flow? Can you lower my inflammation, regulate my hormones to help my uterus be more receptive, help lower those androgen levels? And after about 4.5 months, she finally ovulated. ended up conceiving naturally and having a child. And then we
Mm.
have a few other cases similar to that. And so what I've heard today is there's not great evidence for a lot of things, but there's still some common sense. And the preconception part, because there are risk factors that come with this metabolic disorder, that if your
Mm.
cycles are irregular and if there are things that you do that will then lead to more regular cycles, this is pushing you in the better direction to have better pregnancy outcomes, better chance of getting pregnant and pregnancy outcomes. And we've seen this. We know that if you're very overweight and you lose a percentage of your weight, 5% or maybe 10%, that there's an increase in ovulation. We've seen it with acupuncture to help support ovulatory disorders as well, and certain diet and exercise, of course, as well. So there's things that people can do to help balance their hormones, lower the stress levels, because stress leads to cortisol levels and blood sugar dysregulation and insulin. It's again, it's which is the chicken or the egg, right? I guess my broken record, and I'm curious what your thoughts are, is no harm's going to come from living a healthy lifestyle. So eating well, like nourishing your body with good food, moving your body, finding time to rest, and having good sleep, right? Like
Yeah,
the
that's the
negative.
key.
Yeah,
That's the key.
that's the key, right? And then you can
Yeah.
add, some people add supplements, some people add acupuncture. I'm going to have to send you some of my literature on the low-level laser therapy that I've come across. And then we both have seen it and we agree with it, integration. So I never tell somebody, don't do letrozole, don't do Clomid, don't do IVF. My goal is baby. My goal is healthy baby for the women I see and a healthy mom. I think it's just the order that we both agree on, that
Mm.
the diet, lifestyle, exercise, the acupuncture would come before you would do the egg retrieval, the IVF, the months leading up to it. And before, if you're still having your regular cycles, signs of high androgens, then maybe before you do that frozen embryo transfer to get things in order. And we talked about age earlier. I'm seeing somebody now that just came in and she has frozen embryos. So I feel that we have some luxury with time now because she already has the embryos. So now we're just going to help uterine receptivity in that she has really delayed cycles up to 60 days. So our goal is, what can we do over a couple of months to see if we can help with the androgens, the insulin resistance, and evidenced by her cycles becoming more regular. Does that make sense to you? I'm coming from your scientific mind here, because I'm going from a theoretical here.
Yeah, but I think everything we can do before you start with any medical treatment for ovulation induction or IVF, full protocols and so on could be good. It is vital, I would say. We know exactly, as you said, that if you're slightly overweight or obese, just losing a couple of kilograms can make a big difference. And it is important also, I would like to say, to stress that women with PCOS, they get their wanted children. There is no difference in number of children a PCOS woman gets compared to a non-PCOS woman. But they have lots more problem. They need assistance many times and they miscarry to a much higher degree. So there are problems with implantation, even though many gynecologists they claim that PCOS, it's no problem. We just stimulate them and they become pregnant. Yeah, but many of them have implantation problems and they get miscarry. Not just early miscarry, they get relatively late miscarriages also. So preparation before is vital, I would say.
Can we talk just a bit about the acupuncture protocol for increasing blood flow and supporting or reducing ovulation? I remember originally we met, you were doing and this is because we have acupuncturists that listen to the podcast as well, like bladder 23, 27, 57, and spleen 6. And then later, when we met over in California at a conference, you were doing kind of like spleen 6, spleen 9 with the 2 hertz, and then the abdominal points like stomach 29, Ren 4, Ren 6. And then at my IFS, you talked about, I think it was stomach 34. I'm using the acupuncture points because that's what they're familiar with. For your blood flow protocol as of now, what's the one that you favor, or would, if you're clinically going to be treating people, the one that you would like to use? What kind of points and what kind of hertz would you be putting on the needles at this point in time?
First of all, why we actually moved more to place the needles in the abdomen, it was based on my postdoc studies on rats, that we measured the ovarian blood flow changes, and we placed the needle in abdominal muscle. Therefore, we moved to place the needles in the abdomen, because when we did that, we could see an increase in ovarian blood flow. So therefore, we moved to place the needle in abdomen, and it's also more easy to get them laying on their back, and they can relax better and so on. And then spleen 6 and spleen 9 or LR, liver free, they're all in the same innervation area as the uterus and ovaries, and also the points in the abdomen. But you can still use bladder points. I think the most important here is the woman can relax.
Okay.
So if she prefers to be laying on the side, that's fine. The stimulation of the needles, before, if you asked me a couple of years ago, I would say you must go with low frequency electrical stimulation. But given what we actually saw in the big JAMA paper with more than 1,000 of women, we see absolutely no difference when we place a needle deep and stimulate with electrical stimulation compared to superficial stimulation and placement and very weak stimulation. So I cannot say that it is more effective to place a needle deep and do electrical stimulation. Still, in an ongoing trial, we use more or less a very similar protocol, that we aim to increase the insulin sensitivity. And there we stimulate in the big quadriceps muscle. And there, I think it's more important to get the muscle contraction, more to mimic the exercise.
Okay.
So I think sensory stimulation, if it is strong stimulation with electrical stimulation or just manual stimulation or superficial, I cannot say that one is better than the other.
I'm sure at one point we'll find out, again, based on the patient, the individuals, some respond better based on them, right? Based on their constitution, what's going on.
Yes.
And that's the power of Chinese medicine, where they don't like to do protocols. They use it as a guide, but then what's on your table, and then treat what's on your table. So your battery's dying. So we're going to wrap up. And you give me so much of your time today, which I appreciate this. So if I can recap that this PCOS condition can impact the placenta and the health of the baby in pregnancy. So preconception care is something you want to do before you are pregnant. And if you don't have frozen embryos, you're not just looking at uterine receptivity, but you're looking to get pregnant naturally or through doing egg retrieval or ovulation drugs, you're still of the idea that do some of this preconception over that 3 to 6 months before going in there to have a better or positive impact, so you can have better pregnancy outcomes, because our goal is always healthy baby. And we talked a little bit about acupuncture, and in the acupuncture, you're talking about that it can help with the insulin resistance, it can help with blood flow, it can help with regulating ovulation. And then we deduce that if we can help regulate ovulation, there's lots of positive impact by lowering the androgen levels or having balanced hormones through more regular ovulation. What is next for you? What are you studying? And you talked about immune, also how it impacts the immune cells too. So it's really, really interesting. And diet, lifestyle, exercise is something that nobody can ignore when you're looking to address this condition. What else is in the pipeline for you, Elizabeth? And then I'll get from you in our email just where we can direct people if they want to learn more about you or follow stuff that you're doing. But please give a shout out to any links and what's coming up for you now.
Yeah, we have an ongoing trial that it's a 3-arm trial on women with PCOS that are overweight or obese, and they are randomized to receive lifestyle management, which is a very light variant that they get the information that it's important to do regular exercise and have a regular diet and how they eat, but it's no specific diet. All women receive this lifestyle management. And then one group receive on top of that metformin, and the third group receive on top of that electroacupuncture for 16 weeks. And before and after 16 weeks and after 16 weeks, we follow up again. We take tissue biopsies, we take endometrium, fat, and muscle biopsies. And we perform detailed molecular analysis on single cell level. So we do single cell RNA sequencing, and to really try to understand more mechanisms and which cell types are affected in women with and without PCOS. We do oral glucose tolerance tests. We do DEXA to look at the fat and muscle mass and bone mass, and a lot of hormonal analysis. In these women, we also look at the immune function, because in these tissues, we get all the immune cells, and we analyze the immune inflammatory panels with a method what we call O-link. So that is in the human studies. We look into try to understand the pathophysiology in each of the different organs and on the whole body. And then we, in the animal studies, we move on with it, try to understand the mechanism behind the immune dysfunction. And in another project, we try to continue with this and understand if it is the in utero environment that actually trigger that the offspring develop PCOS and they transferred across generations, or it is the fact that it is actually the oocytes that are affected in the woman with PCOS. So here we have a mice model that developed PCOS with or without PCOS, and then we treat this model with anti-androgens, flutamide, that block the effect of androgen receptor. A treatment that women with PCOS can get is to have hyperandrogenism. And the fourth group, we are letting them exercise for 5 weeks. And then we do superovulation, collect the oocytes and fertilize them with healthy sperm. And then we do embryo transfer into a surrogate mother and study the offspring, the first generation and the second generation. And this is an ongoing trial. These are mice.
Yeah, I just because the listeners
Actually,
probably thinking,
yes, we do this to try to disentangle and dissect the mechanism. Is it the in utero environment, or is it actually that you have the programmed oocytes? It is the eggs that actually transfer. That is what we want to understand. We still don't know that.
And this is what you're studying. You don't have conclusions yet.
No.
We will. So we're going to have you back on the podcast. We'll study that again.
Yeah.
Elizabeth, I want to thank you very much for making the time today to chat and always sharing your research, and you're unbiased, right? Just telling us what's happening, what it is. And that diet lifestyle, I want to just emphasize that. The things that people can do is regulate their blood sugars, reduce stress, doing things like exercise, rest, good sleep, and eating a healthy diet, right? You talked diet wasn't not researched well, but there are certain diets that are just highly inflammatory and can affect your blood sugar, and we're looking to not do that. So a healthy diet. That's great news. I really appreciate everything you shared. Where do people find you? Are you on social? Are you on Instagram? Where do you want people to find you if they're looking to see what you're up to?
Research-wise, I usually share it on Twitter and on LinkedIn.
So we'll grab that from you, and I'll put that in the show notes. All right. Until next time, enjoy the rest of your evening there over in Sweden. And
yes.
Again, thank you so much for your time. I really appreciate it.
Thank you. Good to talk to you again, Lorne.